MentraPath study is a randomized comparison of catheter ablation and antiarrhythmic drug therapy as first-line treatment for paroxysmal atrial fibrillation, and 5 years follow-up results were reported in London.
After 5 years, there was a significantly lower burden of atrial fibrillation in the catheter ablation group than in the drug therapy group. Significantly more patients were free from any asymptomatic atrial fibrillation in the catheter ablation group than in the drug group, and only 3% in the ablation group and 5% in the drug group had developed persistent atrial fibrillation. That's very few. 2 years, the patient's quality of life score was significantly better than at baseline in both treatment groups, and with no difference between groups. And now, after 5 years, still quality of life is significantly better than at baseline with both treatments and without any difference from 2 years.
This is a prospective study enrolling patients from ordinary practice who are being initiated on rivaroxaban, and then following them, collecting data at the point of initiation, at hospital discharge when applicable, and quarterly for a period up to 1 year. The results were very reassuring in the sense that major bleeding was seen in only 2.1% of patients, and all strokes were seen in only 0.7% of patients. So these were very encouraging results.
My presentation was the Certitude cohort study, comparing two groups, patients in whom we implanted a simple cardiac resynchronization therapy and cardiac resynchronization therapy plus a defibrillator. We have seen that the profiles were very different. In 2 words, CRTP for older and more severe patients, and that when we look at the causes of death, of course the mortality rate of CRTP is higher, but in a large majority of cases their deaths were non-sudden cardiac deaths. In other words, it would not have been useful to implant them a defibrillator.
The key message of these guidelines is, first of all, use very well medications to treat patients with myocardial infarction, heart failure, hypertension, and so on. Medications are there and should be used properly. Second, identify families with risk of sudden death and extend the evaluation of the substrate to the family members to prevent sudden death that is genetic in origin.
The registry is named ELECTRA. This is a registry about the lead extraction procedure. It's a European controlled study on lead extraction procedure in Europe. Extraction procedures are really effective, efficient, because we have a very high percentage of success. 96–97% of leads were extracted with a complication rate of medially 2.7%, but we analyze in a different way centers with high volume activity and centers with low volume activity, and there was a very important difference among these two kinds of centers in terms that centers with high volume had low complication rate than low volume. The conclusion are that transvenous lead extraction is a new activity in the arrhythmology and must be proposed to patients with infective indication as a first option to cure the pathology device related.
A leadless single pacing pacemaker has been evaluated in the Leadless 2 study, a non-randomized trial in which 300 patients from 56 North American centers has the device transfemorally implanted in the right ventricle. Vivek Reddy summarizes the key findings 6 months after implantation.
Number one, the device can be implanted in 96% of the patients. Number two, there's about a 6.5% rate of major complications, and we expect this to decrease over time. We have to remember that 99% of the operators had never performed a device implantation before. Number three, the vast majority of patients, once the device is successfully implanted, has adequate sensing and pacing over the long term. And number four, the expected longevity of this device is out to 15 plus years.